So in my practice, I see a lot of guys who think that exercise is too difficult for them for a variety of reasons. They feel too old, they feel too sick or too fatigued, they've got bad back, bad knees, and so on. And these are common concerns. And exercise physiologists are trained to work around these concerns and have an individualized program that allows each man to get involved with an exercise program safely and to actually get some benefit out of the exercise program regardless of how old or unwell or what other conditions they may have. So we've had many guys that never want to come in and do exercise and are very reluctant to do it, and who keep coming back years and years afterwards and love it and enjoy it, and it's a core part of their lifestyle. So a very common concern many men have is that exercise is too expensive. And while I certainly understand that there is cost involved, I think when you weigh this with the benefits of what exercise can have and the ability of exercise to prevent a lot of other issues in the future, it's a really smart investment to make to start to get involved with an exercise program. And I like to think of it as probably the best insurance policy you can buy because exercise is a very protective therapy or intervention against pretty much every sort of chronic disease, and especially with prostate cancer, these can become relevant as you get older. So for a lot of guys, they're juggling a lot of different appointments and commitments and work, so it can be very difficult to fit in the time to exercise. But again, if we go back to how effective exercise can be, it's really important to make time for exercise and prioritize exercise in your day. And having a plan can be really important to be able to make this time. And there's a lot of things you can do at home and multitask to actually incorporate exercise and physical activity into your everyday lifestyle. And again, an accredited exercise physiologist can help you implement this plan, or develop a plan and implement the plan into your everyday life. So for many men suffering incontinence, exercise can be a thought that never even crosses their mind, which is completely understandable. Now, there is evidence out there to show that pelvic floor exercises are very effective in terms of preventing incontinence before a surgery and also helping to restore continence after surgery. Now, in addition to that, we know that full body exercise can help keep weight at bay, and we also know that weight is associated with poorer continence outcomes. So exercise can be an important tool in terms of minimizing continence after prostate cancer treatments and also helping to restore continence function following prostate cancer treatments. So for many men, not knowing what exercise to do is very common. The exercise guidelines, what's recommended for significant health benefits is to try and accumulate 150 minutes of moderate intensity aerobic exercise each week. Now that's about a 30-minute walk. It's a brisk walk on 5 days a week. And what's really important is the intensity. So it's not just a dawdle down the street. You need to be working hard such that you're puffing, your heart's beating faster, you're working up a sweat, and it feels between somewhat hard for you in terms of the amount of exertion. Now, in addition to this aerobic exercise, the recommendations stipulate between 2 to 3 resistance exercise sessions each week. Now, the resistance exercise is lifting weights, so things that you would commonly associate with going to a gym or a fitness center. And again, the intensity is really important here. It needs to be a moderate to high intensity. So it needs to be working hard such that your muscles are feeling fatigued and again, you're having an increased heart rate and you're breathing a little bit harder.